Today's topic for Coffee Talk is PRP, platelet-rich plasma, for people who have a hair transplant. So, if you have PRP before you go for your hair transplant, a minimum of 3 treatments, it improves the capillary blood supply to the area and you have a better chance of your hair transplant taking well. We call it a primer. However, this is fine if you are here in Ireland, you're having your hair transplant in Ireland, you've had your 3 steps beforehand, you've had your hair transplant, and then the recommended platelet-rich plasma treatments, which is usually about 3 after your hair transplant is discussed. That's if you're in Ireland. But the poor lads are heading off to Turkey with no prep done, having their hair transplant, which a lot of them are very successful, but there's no aftercare. So they fly home after 2 or 3 days and they need aftercare, PRP, in order to enhance the growth factors and stem cells into the area, and it gives the hair transplant a better chance of taking hold. So there is aftercare from a hair transplant. Anybody who's had a hair transplant knows what they have to do. They usually have to clean the area with saline for a couple of days, and we're talking about the aftercare usually goes on for about 2 weeks, and that's fine if they know about that aftercare. But the long-term aftercare, in order to get the hair transplants to be very beneficial and to take hold properly, PRP treatments is usually recommended 3 sessions after the hair transplant is done. So a lot of these lads that come back from Turkey don't know about PRP for hair transplants, and then on the ones that the hair transplant doesn't do very well, they've wasted their money. So if you or anybody that you know is going to Turkey for hair transplants, and I've seen them here all the time, some of them are really, really successful. There are the occasion few that don't take as well as they might like, but it does depend on lots of factors. I don't do hair transplants, but the follicle quality, the skill of the artist, and so on. And I think a hair transplant in Turkey is about 4, maybe 5,000, as opposed to the hair transplants here in Ireland, which are about 13 to 15,000. So I can see why people would travel to Turkey, and I have seen great successes, but I've also seen transplants that haven't worked very well. And yeah, it's like, is there a proper assessment done? Is there proper aftercare being done? Is there proper prep? We're not seeing the prep. Is there proper aftercare and advice to be able to give the hair follicles the best opportunity? So if you know anybody, do tell them to come our way. We'll do a series of 3 platelet-rich plasmas on the scalp, 4 weeks, not 4 months, 4 weeks apart. And so that'll be 3 months before you make your trip to Turkey. Then you have your hair transplant. Then you follow their aftercare for 2-3 weeks, and then you come to us for 3 more treatments. And then it's very likely that you'll have a very successful outcome. All right, give it the best shot. Going to Turkey is no easy feat. Making the decision to have a hair transplant is no easy feat, be it Ireland or Turkey. So just so that you know, if you're going to make that commitment to have the hair transplant done, give it its best shot. And we're here. The booking link is in the bio. All right, I hope that helps.